Sometimes the things that have the biggest impact are the things that are going on behind the scenes. And when it comes to running a doctor's office, billing often steals the show. That's why we're here talking with Dr. Lalita Matta and Andreia Medeiros at Marlborough Internal Medicine to discuss the RCM process with them and their practice. Dr. Matta, Andreia, thank you very much for being here today.
Yes, we're very happy to be here. Thank you for giving us an opportunity to tell our story.
Yes, thank you.
Well, we are eager to hear it. Tell us a little bit about Marlborough Internal Medicine to begin with.
So Marlborough Internal Medicine is a small private practice. We've been in this area, in this location, for more than 20 years. And we pride ourselves in being, in providing quality care and an example to the community. And we hope actually even at a broader level, because as everyone knows, in today's healthcare environment, it's really hard for small private practices to survive, never mind thrive. So we feel we have actually done really well. And some of the story that we're going to be able to talk about today is how that has happened, and our partnership with our close vendor, which is eClinical, has given us the opportunity to grow. And with some of the newest features, which is the RCM that you want to talk about today, that has really helped enhance our practice. So we're happy to talk about it.
Well, you've been here for a long time, as you mentioned, but you've also been using eClinicalWorks for a long time.
That's true.
Correct? Tell us, how long have you
I'm glad you brought that up. I almost forgot, because, we were, I feel, probably one of the earliest clients eClinical had. And it was when the CEO, Mr. Navani, was still trying to, establish the product. So I think I might have been one of his first handful of clients. I forgot about that.
Have you seen the product I'm sure you have seen the product change a lot over the years.
Yeah.
Is it like a good old days kind of thing, or are the best days here now?
No, I think the latter. It's the good news is that they pride themselves in a few things, eClinical as a company and as a product. He made a promise to me. This was 15 years ago when I started, right? 2001, so almost 15 years ago, that the cost will never change. That promise has held true. So the product has obviously grown and evolved, and you guys know that better than I do. We've seen in the beginning that because we were one of the earliest clients, and shortly after that the company took off, the product became popular. We did see some issues because they had their growing pains. You had growing pains, and as a result of that, we were not able to get the support we needed when we needed it, and we struggled a little bit. That was fixed very quickly, so we do remember those days. These are the good old days.
Well, it's good to know that those things were resolved.
Yeah, most
quickly.
of it was. Yeah.
But of course, today we're here to talk about RCM services. So would you be able to tell us a little bit about what made you decide to move forward with those?
Yeah, I was reflecting on that before we got on air. So, prior to the use of RCM, we tried to do it all ourselves, right? We had internal biller, and we muddled through, is the best way to put it. And we had some data. She was able to give us limited high-level data, our biller, but the items on it were not actionable for me. And me, as I'm going to emphasize, being a small practice, a one-man show more or less, right? It was hard for me to do much with that data. So we struggled. So when this opportunity became available, and I'll, look at Andreia because she's the one. Andreia's been with my practice now for how many years? Has it
4
been?
years.
4 years. A lot changed after she came on
Yes.
board with me. And so when she mentioned this as an opportunity, and we looked at it, it actually looked like a no-brainer.
Right.
Really, it looked like a no-brainer. So I'll give you the advantages that we saw. So the cost has been, and we'll get into the numbers if you like in a little bit, the cost was advantageous. But other than that, what from my perspective as the provider, what I saw was we were already entering the diagnostic codes which you need for billing purposes. It's streamlined into eClinical. And I've compared this with some other larger practices that use other EMRs. That is not streamlined. The ICD codes don't become part of their note. So when we enter the codes, it's already ready in a way for billing. So transitioning to RCM was so smooth and seamless for us and seemed like a no-brainer because not much scrubbing or anything needed to be done. We were already always doing that. So that seemed very attractive. And then, of course, when we looked at the numbers and we did the math, we were like, okay, this is what we paid to our biller, and she has the numbers if you need. This is what we paid to our biller, this is what we paid to eClinical, let's do the math, and this is what we'll be paying now. Well, wait a minute, this looks pretty good. Actually, to be honest, at first we thought something was wrong. Mm-hmm. But it really has played out exactly the way it was presented. So those were the obvious, reasons to move to the RCM.
Well, we'll definitely want to discuss some of those numbers in a little bit here. But before we get to that, before we get to kind of that end game idea, what are some of the key features of the RCM service that we're able to fill some of the gaps that you found in your workflows?
Yeah, so for sure I can elaborate on that.
Yeah.
The key features...
I'm going to interrupt for a second and just point out that Andreia is the front end for our practice, being the manager, who deals with the whole RCM team, obviously. And she has been instrumental in actually making this really successful. So I really do feel she has a good insight.
So yes, there are great features with RCM, and one being the dashboard. The dashboard is like everything to me. It is so helpful. It is real time. It's great. This is not something we had before. That we had one person. The dashboard and the RCM team can do the job of many. And in order if we were to try and hire those many people, we couldn't, because being a small practice, we can't afford something like that. The dashboard, again, has many great features within that one feature. One is their analytics. So I look at that daily. It tells me how many encounters are unlocked, how many are locked, how many are, I do a comparison to last month. So I'm able to tell the providers, listen, you need to start locking these. That's how we get our claims out.
I think that goes back to what Dr. Matta was saying about those actionable items. I'm sure, when your previous biller was here, she wouldn't probably even know to look at the lock notes.
Right. No, we didn't have a process in place for that. No. So it really was. It really helped us to stay on track with completing our notes and in the process making sure the billing was being done in a timely manner.
Right.
Claims were being submitted. So I think it helped us keep better flow of revenue.
Can you think of any other actionable items that play a key role day to day, or?
I think our net collections was what we looked at, didn't we?
Yes, definitely. I don't think we were, first of all, we couldn't even look at our net collections before. And now with the RCM reports that we get monthly, we're able to see, and we've been told by RCM, and we've done some of our research ourselves, according to the national average, our net collection is average 94, but there are months we're at 98%. I mean, it is outstanding, and thankfully because of RCM and our involvement as well.
Tell us about the RCM process in a nutshell for your practice. What is that?
So once an encounter is locked, it is then sent to our billing, our RCM. There is now a new feature which we like. It's the ready to bill feature. It is, when we heard about that, my first thought was they heard me, because several months ago I thought, okay, if we could have something that would catch these claims before they actually go out. Some of these silly errors like a modifier, and as helpful as RCM is, they're not coders, and they've told me that up front, and I can respect that. And so what they do is they send what we give them. So if we send an unclean claim, that's going to reject. So what this feature now does is it catches those claims before it goes out. So what does that do to us? It decreases the amount of denials, which ends up being happy campers on this side. And that's pretty much in a nutshell. So as far as RCM, the involvement is we do weekly calls with our account manager. And the account manager is very, very helpful. He is my go-to person. He is one call away, an email away. He is very good at getting back to me with any questions, whether it's patient collection related or claim related. He's very good. We like to maintain that good communication. And that's that.
Join us in Nashville, Tennessee for the 2015 eClinicalWorks National Conference, October 16th through the 19th at the Gaylord Opryland Resort. Join over 4,000 eClinicalWorks clients just like yourself as we take the national conference to new heights. Our event schedule in Music City is jam-packed from start to finish, kicking off with a keynote and product showcase by CEO Girish Navani at none other than the Grand Ole Opry. Follow that with over 120 breakout sessions, on-site support and training centers, and an exhibit hall with the latest and greatest in eCW innovations. We can't wait to see you at this year's conference, where we'll be kicking up our heels in Nashville, Tennessee. What things would you use to describe, would billing health be the right term for it? What would you use to describe the practices, billing or financial health, and how has that changed with RCM services?
So I think overall, because things are being done in a timely manner, the denials have gone down, accounts receivable has improved, overall our financial health is good. Right, so now we track it, where before we didn't really track it. So we look at reports on a quarterly basis most of the time. She probably looks
together,
at it.
yeah,
Together we look at it. And that allows us to do a deeper dive on certain issues, and we actually able to often come up with actionable items on what needs to improve. Because now I'm not worrying too much about, what's in the bank balance, on a monthly basis, because we did get into some moments before our implementation of RCM, we did have some issues. Now I can pay attention to quality measures, for example. So obviously we're in a health, in an environment where everyone is being tracked for quality measures, and rightfully so, we should be. So we have, in the last few years, successfully been able to attest for many of those measures. We have done stage 1 and stage 2 of meaningful use successfully. We have gotten robust, healthy checks for that. We have attested for PQRS, which is, most people have heard of the Physician Quality Reporting Initiative. And this year we have entered the ACO, Accountable Care Organization, with UMass. And not only that, we actually, one of the big successes, the way I look back in the last couple of years, has been population health. So we are part of a larger group with UMass, and we get tracked for our population health outcomes. And we have now, I have personally had the time to look at that. I didn't have that.
Right.
You brought up time, the time aspect several times here. So how much time would you say you've been able to save? What kind of an impact there?
Yeah, it's hard to be very specific about it, but I can tell you that the largest impact on time directly would be on the manager and myself. It doesn't affect the rest of the staff, because
Right.
obviously we have other staff. In our practice, I didn't mention we are 6 or 7 staff members. Doesn't impact the others as much, but directly it has probably freed me up, I would say somewhere between 10 and 20%. It's really hard to be specific. And Andreia can speak for herself.
Probably a little bit more. Before
yeah.
I was dealing with all of the denials, calling insurance. I don't do that anymore. I can't remember the last time I called Blue Cross Blue Shield, so that's time. When you get on the phone with those payers, it is time consuming. and time is money. So I'm very grateful to have a team that does that type of thing for me.
What have you been able to do with that time?
Yeah.
That you've now
So,
freed up?
like Dr. Matta just mentioned, I've been able to focus more on, managing is difficult, and I'm lucky that I have Dr. Matta with me, guiding me, and I've been able to work more with her on the meaningful use. I wasn't as involved before because I didn't have the time. And when I got into the meaningful use, I was able to find some areas that we needed to improve in order to attest. Had I not been able to do that, we probably wouldn't have done that well. There wasn't someone really looking and paying attention at some of those areas that needed improvement. I can't really
But I
pinpoint.
can add, because you're in the middle of it, so it's hard for you to be as objective, but I can add. Andrea has been the manager for the last few years. In the beginning, I don't think you were the manager in this practice. That itself means that she's actually managing the rest of the staff. That is, and I'm not being hands-on anymore. So in the past, it was me. It was monthly, quarterly, whenever we met with the staff. I've passed that on to her.
Oh, so that's freed up some
It's
of
freed
your
up my time.
responsibilities
So
as well.
exactly, I'm glad you brought it up because I'm reflecting on it now. Andrea has been getting everything that I really don't want to do goes to Andrea now, and she couldn't have done it if she was still busy doing the billing every day.
Right.
You said you pulled together some numbers in terms of maybe some
Savings.
and
So
things like that.
definitely. The first year when we looked at using RCM and not using RCM, we saved about 20% when we switched to RCM. So if we were to go with specific numbers, what we paid in 2014 to eClinical with the RCM services and all of the other features that we use, the messenger, the kiosk, the patient education, and of course the license itself, we paid $28,000. The previous year, for our biller alone, we paid $25,000. And of course, eClinical itself was about $14,000. So you can do the math. That's $39,000. So that's roughly about a 20
Yeah, about 20 to 25%.
25%. That was great. I mean, we couldn't have been more satisfied, I guess.
I'm sure that number would scale as well with larger
Large
practices who
practices,
maybe
of
have
course.
more
Exactly.
billers and would be able to save more in that
I would
regard.
imagine, yes.
Exactly.
Tell me a little bit more about the dashboard that you get with RCM.
So the dashboard is the best thing ever. The dashboard is my best friend. I look at the dashboard every day, and what the dashboard provides me, I would probably have to hire different people to do what it does for me. Within the dashboard, there's different features. One is the analytics tool. I can look at it from a perspective of how many encounters are locked versus not locked. And of course, we know that if they're not locked, they need to be locked because that's how the claims go out and that's how money comes in. There's also a provider section where you could even show it to the providers to see, they could get competitive to see, Dr. Matta has this many locked encounters and Estrella doesn't, or her notes are done and hers are not done. So we
do that, actually.
Yeah, so it kind of gets a little competitive. So that, to me, that's great. Let's get these notes finished and done so RCM can build them.
As I summarize and I reflect on what this has been for us, what this has meant for us, I thought of a couple of things. Yes, maybe we didn't get certified for PCMH, but all the time that we spent preparing for it has positioned our practice well now that we can look for recognition. We, in the last few years, got the Community Recognition Award in our area. You forget, these things that you collect accolades over a period of time. But when you put the big picture together, what positions you to do it? Things have to be, all your ducks have to be in a row, and things have to be working smoothly for, practice to not only survive, but to get all these accolades. So as I reflect today, I feel like this partnership with eClinical, I strongly believe that the RCM has definitely been the added feature that has made our life easy in the last couple of years. But even before that, our partnership with eClinical going way back up to 2001, actually, I couldn't have done it as a private practitioner. and many times other practices, large organizations have tried to buy me out, and I wouldn't do it. I just wouldn't do it. I feel private practitioners still have a future in this country. You just need a good partnership with whether it's your EMR. It's with the EMR, I would say. That they partner up with you, make your life easier. My practice has grown, beautifully in the last few years. I'm not looking for a lot of vertical growth anymore because we're at a good place. We're looking for more horizontal growth. Where do we add value for our patients? We're not looking to exponentially enhance our revenue. But what value in the future are we going to add to our patients? How are we going to improve healthcare one patient at a time, And that's what matters to me at this point the most. And I'm quite secure that I'm going to be fine. And my patients are going to be fine.
Any other financial health measures that you care to share with us?
Yes.
Yeah, I think we both have looked into that. And I'll tell you what I see in the big picture, and you may be more specific on the numbers, Andreia, is that in the last couple of years, we have seen a trajectory, where our revenue has, what is the percentage? Is it
26%.
26%.
Yeah.
So first of all,
since starting the RCM services?
So the first year alone of using RCM was a 26% increase.
So clearly that is not entirely attributable to RCM, and it would be hard for us to tease the numbers apart to reflect how much of it is RCM related and how much it is perhaps the natural growth, etc., because other factors come into place. But RCM, I'm sure, has a significant portion to play in that. So that if that trajectory continues, that for us is more than what we're looking for.
For other organizations that are interested in the RCM services, what advice would you have for them?
So what I would say is for small practices, I would say it is a no-brainer to use RCM because it just is, it consolidates, the processes, and it's already a streamlined product, so it's really this transitioning from whatever you're doing to RCM is so smooth and seamless that it's a no-brainer. The cost is, obviously, we've already talked about the cost, so that makes it very favorable. So I would say that for small practices, it is absolutely a no-brainer. I would imagine that for large practices, it should be no different. So I have no hesitation in recommending it to other practices. What I would add is, because I only know how we function, and I know that we function in a model where Andreia works extremely closely on a day-to-day basis, as she has already illustrated, I would imagine that the team approach is needed, because if a practice is not providing the support that I know Andreia provides to the RCM team, but I think she provides it in a very collaborative manner. She finds, occasionally you find, certain things could have been done differently. She works really well with them. So I would suggest that if any practice is looking into it, that you provide a really resourceful person at the front end like Andreia to make this work out as a win-win for everyone.
Have that point of contact.
Have that point of contact, not only just for the contact, but for overseeing it from your internal level.
Right. I think, like you said, Dr. Matta, this is really a team-based
process.
Yeah, it really is. Communication is key, and if you have that, you're good.
Excellent. Well, Dr. Matta, Andreia, thank you so much for your insights today for the eClinicalWorks podcast. I'm Adam Siladi. You can check out our other episodes on YouTube, iTunes, and on my.eClinicalWorks.com.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.